Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, the Mayo Clinic Liver Transplant Program, there's 3 different sites. All 3 sites do liver transplants: Arizona, Florida, and of course the mothership, Minnesota. And the 3 of them combined perform over 300 liver transplants every year. Now, unfortunately, like other organs, the number of people who are waiting for a liver transplant far exceeds the number of available donors.
Because the human liver regenerates and returns to its normal size shortly after part of it is removed, living donor liver transplant is an alternative to waiting for a deceased donor liver to become available.
Now, isn't that interesting? The liver can actually regenerate itself, make more of itself, the only organ in the body that can do it.
Here to discuss liver transplant is the Division Chair of Transplant Surgery at Mayo Clinic, Dr. Charles Rosen. Welcome back to the program, Dr. Rosen.
Thank you. It's a pleasure to be here.
So, Dr. Rosen, nice to see you. Mayo Clinic Rochester, one of the sites that does liver transplant. So tell us why someone would need a liver transplant.
A liver transplant's done for anybody that develops liver failure. It can happen rather suddenly, and we call it acute liver failure, and that can be either from drugs such as Tylenol overdose, it can be from an acute hepatitis caused by a virus, or a couple of real rare conditions, and sometimes it's just a drug interaction that we don't totally understand. Also, people can have what's long-standing liver disease or chronic liver disease that over a period of years develops into cirrhosis, and that can be caused by alcohol, a lot of viruses that can cause cirrhosis, as well as some diseases that we have fancy names for but really don't understand all that well.
So cirrhosis basically means that the liver, scarring of the liver.
That's right. And the liver, when the liver is an organ, as you mentioned, it can regenerate and grow back. But for some reason, when it gets diseased, it grows back and develops these fibrous scar tissue that keeps it from regenerating to its full capacity and results in problems.
Did I hear you say that if you take too much Tylenol, you can get acute liver failure?
Unfortunately, that's true.
Now, how much is too much?
Too much.
I'm sure
Too
it's
much.
variable, but I mean, is that over a long period of time you've taken Tylenol, or can it happen if you just take too much once?
No, it's if you take too much once. And unfortunately, in some countries like the UK or the United Kingdom, it's a form of suicide. Occasionally, it can be that done here, or it can be inadvertent. And if you also drink alcohol with a Tylenol, the 2 of them together is not a very good combination.
Really?
But you
Didn't
have
know
to
that.
take quite a lot.
No.
If there is a lack of livers available for donation, why aren't more living donor? Why isn't that happening more often?
Well, first of all, it's kind of exciting. 2016 was a wonderful year for transplantation. It was the highest number of donors ever in the United States.
Wow.
There were almost 16,000 donors, and 33,600 people got transplants last year. Both those numbers are up about 10% or 9% from the year before, and organ donation is actually up about 20% over the last 5 years. So we're fortunate in the United States that the deceased donation has gone up, and we would much rather do that rather than a living donor transplant. When you get the whole organ with the larger vessels and the bile ducts, things go well. A living donor transplantation is a way around it for people that can't get a deceased donor because of their position on the waiting list. There are more problems in the recipient with the bile duct because it's shorter and smaller, and the same with the blood vessels going to and from the liver. And of course, the donor has to undergo a pretty major operation. It involves taking out up to almost 70% of the liver in some situations. The liver grows back fine, but just the course of the operation, dividing the blood vessels and dividing the liver, can pose some risk to the donor. And the risk to the donor's life is actually about somewhere between 1 in 200 to 1 in 300. So it's not insignificant.
So 1 to 2% chance that you'll die being a living liver donor.
1 in 200 to 1 in 300, so about
okay.
0.5. Yeah.
Wow, but still.
It's a big risk.
What's the average wait? How long do people typically wait for a donation?
Ever since the early 2000s, they changed the allocation for liver based on the government's kind of directive to the transplant community to transplant the sickest patients first. So it isn't how long that someone would wait for a transplant, but how sick that they have to get. So waiting time doesn't really matter unless you have a condition where the score is adjusted because of a tumor or something. But unfortunately now, many of our patients are getting far more sick than they were years ago. Oftentimes they're in the intensive care unit or even on dialysis for kidney failure that results from the liver failure.
So I heard you say, I think that you would prefer to do a deceased person's use their liver as opposed to a living donor, correct?
We would always prefer to do a deceased donor liver transplant over a living donor transplant if we can get the liver.
And the only reason that you would do a living donor transplant is if the person on the waiting list you couldn't find a deceased liver donor for that person?
That's right, and the reason we wouldn't be able to find it is that they're not quite as sick as the other people that are on the deceased donor waiting list, so their score, which we call a MELD score, model for end-stage liver disease, and that score is lower because they're not at as much risk of dying, although they're still pretty sick. So in those situations where we can't get a liver until they get more sick, we consider living donation.
I think the last time that you were on the show with us, it was after you had just crossed the 1,000 surgery mark. Is that right? That you had just done your 1,000th liver surgery?
That might be true.
That was 1,000 ago. So tell us about the day you did 5 in one day.
Well, it wasn't just me. It was our entire team. And there was a day about a year and a half ago when we did do 5 transplants in one day in Rochester.
Living and deceased donors?
They were all deceased donors except for one. One was a heart-liver transplant, and the liver, that patient had a disease called familial amyloidosis, where the liver is normal, but it just makes too much of a protein, and in order to get rid of it, you have to get rid of the liver.
Wow.
And so you replace the liver with a transplant, and they also needed a heart transplant. But the liver that we took out of that patient can be used for another patient, and we pick patients that are a little bit older, in their upper 50s to 60s or older, and they get that disease when they get that new liver. But it might take 20, 30, or 40 years before it causes trouble. So that day we did do 5 transplants. One was what we call a domino transplant.
Yeah, it was like a chain.
The other were 4 deceased donors.
That's unusual. That must be unusual to have that many deceased donor organs become available on one day.
Right, and we've actually done the math, and for a program that does about 100 transplants per year over 365 days, the chance of, when we do 1 transplant, the chance of doing 2 or more is about 43%.
Wow. Now tell us about pig liver and other organ donation. I know you've been working on that for several years here at Mayo, haven't you? Are we close to the point in time where we can take a pig liver and transplant it into a human?
We're not very close, but
Really?
we're working with pig cells. Dr. Scott Nyberg has a lab and is developing techniques to use pig cells to support a human, particularly the kind of patients that might be in acute liver failure and just need temporary support with an artificial device until a liver becomes available, or even if their own liver were to recover. But to actually use a whole organ from a non-human is still in our future.
More fiction than fact.
Yeah, so far. But you'll get it, won't you? So you do 100 a year at the Mayo Clinic in Rochester, 300 a year system-wide.
Yeah.
That's terrific.
We actually did 131 in 2016
Wow.
with about 21 living donors, and the rest were deceased donors. So it was an all-time high for us as well.
That's a lot of lives saved, isn't it?
It is.
Your liver lets you live.
That's correct.
Mayo Clinic transplant surgeon Dr. Charles Rosen. Time for a short break. When we come back, we're going to switch gears and talk a little bit about about organ donation and how important it is to saving lives.
And myth or matter of fact, each day in the U.S., more than 120,000 people are waiting for an organ transplant. Is that a myth or a fact? We'll find out when we return. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We're visiting with Mayo Clinic transplant surgeon Dr. Charles Rosen, and we've talked about liver transplants and how far they've come, how many the Mayo Clinic is doing every year, how successful they are. But now we need to talk about the importance of organ donation.
Well, first we have to talk myth or matter of fact. Dr. Rosen, each day in the U.S., more than 120,000 people are waiting for an organ transplant. Is that a myth or a fact?
Well, it's kind of in between. The number has gone over 120,000, but I checked this morning before coming here, and there actually today or this morning there were 118,786 people awaiting a transplant in the United States.
Is that
How
just
many
a-
thousand?
118,786.
Is that just a liver transplant
No,
or
that's-
transplant in general?
That's for all organs, kidneys, kidney, pancreas, lung, heart, liver, and a few small bowel.
And you said every 10 minutes, what?
UNOS, the United Network for Organ Sharing, that monitors and helps manage organ allocation in the United States, estimates that a patient is added to the waiting list every 10 minutes for one or more organs. Unfortunately, though, and very sobering statistic, about 22 people die each day that are on the waiting list that haven't been able to receive an organ.
So every 10 minutes, a person gets added to the list, but every, how many did you say?
20, almost once an hour.
Wow.
Someone dies because
Yes.
they couldn't get an organ
Yes.
transplant. Do most of your donors are deceased, correct?
That's right.
And have most of them been involved in an accident, or what's the most common cause of death for an organ donor?
The most common cause used to be an accident with a head injury, but that was years ago when we had very stringent criteria and accepted only young, otherwise healthy donors. We've expanded our criteria quite a bit, and over a number of years, the number one cause for death turned into be strokes and even heart attacks. Where people would lose the blood supply to their brain for a period of time, or somebody that had a stroke where they bled into their brain. This past couple of years, however, it's kind of sad, but one of the rising indications for organ donation has been drug intoxication, either with prescription narcotics or illicit substances.
So you can use those organs if someone dies of a drug overdose?
We can use those organs. It depends. Sometimes the drug might injure one or more of the organs. Or
Especially if it was too much Tylenol. The liver probably wouldn't be so good, huh?
and the Tylenol actually is bad for the liver and the kidneys. Yeah.
I heard an article, I don't even remember, at the end of last year, that said one of the downfalls, one of the bad unintended consequences of driverless cars is that it'll cause an organ shortage. Well, we already kind of have an organ shortage, but have you heard anything along those lines?
No, I haven't. But I'm not in a position to discuss the relative safety of a driverless vehicle.
Well, and we don't even know that yet, do we? What about, have you noticed, it seems to me like over the past decade, the number of auto accidents has actually been declining, and the severe injuries and deaths have been declining, mainly because so many people are using seatbelts. But has there been an increase in auto accidents over the past few years because of texting?
He's giving you a commentary question there.
Probably, but I don't know those figures.
Yeah.
How do you register to become an organ donor? If you're listening to this and you just think, I've always thought I should do that, but where do I start?
Well, that's very important because we think that's one of the reasons why organ donation is on the rise, because now in almost every state, you can either register when you renew your driver's license to be a donor, or there's a state registry in every state that's run by the local organ procurement organization, such that you can put in your wishes in the event of your death. And it really is helpful for your family to do that. Years gone by, we used to say to think about it, make a decision, and share that decision with your family. And now you can share that decision with the registry such that your family doesn't have to worry about what you would have wanted to be done in the event of your death.
Why is it important, though, to have that conversation with your family? Is there, you're involved with this, dealing with the patients. Is there a benefit to that, just talking with your family members?
I think there is, both for the designation for yourself to either put it on the registry or the driver's license, but also talking to your family about it, I think helps settle their mind that the reasons were your own and done for that reason, and also perhaps to talk to your family members about doing the same thing.
All right, but what you just said is that the families cannot override the decision to be a donor, whereas they used to be able to do that, right?
That's right.
So that's that's a huge change.
Yes, it is.
So one way to do it is a driver's license, and you say you can do it that way in almost every state?
I believe it's at least 48 of the 50 states. The other 2 states might have come along already. I don't know.
And when you sign that, does that mean they can take every organ?
It does give consent for all organ donation, in some states tissue as well, but in general the tissue procurement won't be done unless the family consents to it.
What does that mean, tissue?
Tissue is taking skin, long bones, the corneas, the heart for valves, blood vessels. Those tissues can be used for a number of reconstructions for patients, and those tissues, unlike the organs, have to be processed and then sent back to hospitals. And it is a bit different. The procurement can be done without disfiguring the individual, but it's certainly a more invasive thing to do than an organ procurement, and it's done after death.
Is there a way to designate on there what organs you might not want them to take?
Not in Minnesota.
Okay, but some states there is.
I'm not sure.
So it's carte blanche. You can take anything.
Pretty much.
All right. So, and let's talk then a minute about living donors, because with regard to the liver, you would prefer a deceased donor, but you're getting a fair number of living liver donors, but also kidneys, right? And the living kidney donor, that's not such a big deal, is it?
The risk for death for a living kidney donor is much, much less than a liver. It's probably 1 in several thousand. The difference between living donor kidney transplantation and living donor liver transplantation is that a living donor kidney is actually a better kidney than a deceased donor kidney. They last longer and they work better, and they work right away from the outset. Whereas with a liver transplantation, the problems are all technical, and because of the technical complexities, we'd rather have the whole organ rather than just part of the organ.
And if you become a living kidney donor, you've got 2 of them, obviously, it does not shorten your lifespan, correct?
No, it does not. In fact, when people do population studies, oftentimes the living donors, living kidney donors live longer, but that's probably related to their fact that they're so heavily screened and examined before they can go through the donation process.
And giving a kidney as a living donor, not that big a deal, right? I mean, it's a relatively small incision, and you said the complications and the risk of death are very small.
That's right. Nowadays, that incision is kept quite small, and our team mobilizes the kidney or takes it out using a laparoscopy so that they can keep the incision much, much smaller, and the incision is just big enough to take the kidney out through it.
Outpatient surgery?
Almost 2-day hospital stay.
You've got your Donate Life pin on, so as a final message here, what would you like our listeners to know about organ donation?
As always, transplantation is a wonderful thing for patients in need. We can help a lot of people that otherwise have a terrible quality of life or are going to die without a transplant. And it's a personal decision, but I encourage everybody to think about what they would want to happen in the event of their death. It's the one act of giving that one can do after one dies and help a lot of people, up to probably 8 different people, depending on how many organs can be used after death. So it's important to think about it, register as a donor if you're so inclined, and share that decision with your family.
Can a cancer survivor be an organ donor?
Yes, they can, depending on the type of cancer and what type of follow-up's been in place.
And one more question about kidney donation and kidney recipients. It seems like because there is an epidemic of obesity and diabetes in this country, that a lot of patients that I see who have diabetes and other vascular issues with their extremities, a fair number of them have a kidney transplant. Is that the most common reason for doing a kidney transplant today, because of diabetes?
In the United States, yes.
Wow. Other reasons for kidney failure?
There's some diseases that affect the kidney that have fancy names, such as glomerulonephritis and sclerosis. There's polycystic disease, where the kidneys develop a lot of cysts. There's some metabolic defects where the cells don't work right and the enzymes have byproducts that damage the kidneys.
All fairly complex issues.
Yes.
Diabetes, pretty straightforward. And unfortunately, it's if you have diabetes, it's bad for the kidneys as well as most other organs.
That's right.
Dr. Charles Rosen, transplant surgeon at the Mayo Clinic, thanks so much for being with us.
Thank you.